All right, let's talk about rheumatoid arthritis. It affects millions of people, and for a long time, the treatment has been pretty standard. But what if a tiny switch, not in the medicine itself, but just in how you take it, could completely transform the outcome? That's exactly what we're diving into today.
So here's our game plan. We'll kick things off with the anchor drug for RA, then we'll get into the big problem with the pill form. After that, we'll look at the injectable solution, compare them head-to-head with real evidence, and wrap up by thinking about what this all means for the standard of care.
First, let's just get a sense of the scale here. We're talking about rheumatoid arthritis, or RA, affecting about 1% of the entire world. That's a huge number of people, which is why getting the treatment right is so important.
Now, for as long as most doctors can remember, the first weapon in the arsenal against RA has been a drug called methotrexate, or MTX for short. You get diagnosed, this is almost always the first thing you're prescribed.
And it's not just a drug, it's the drug. It's so fundamental that experts literally call it the anchor drug. Think about that. Every other treatment strategy is basically built on top of it. It holds everything down.
Okay, so if this is the anchor drug, the gold standard, why do so many people still struggle with it? Well, here's the twist. The problem might not be the drug at all. It might just be how we're getting it into the body.
You know, with most things you think more is better. But with methotrexate pills, that's just not true. Upping the dose doesn't guarantee that more medicine is actually getting to work inside you. It's a classic case of diminishing returns.
And this all boils down to a fancy word, bioavailability. It sounds complicated, but it's not. It's just the answer to a simple question. How much of the drug you swallow actually makes it into your bloodstream where it can do some good?
Think of your gut like a sponge. At a low dose, it soaks up the methotrexate just fine. But when you start trying to push through a higher dose, the sponge gets totally saturated. It just can't absorb anymore. So that extra medicine, it doesn't really go anywhere useful, and the effect becomes super unpredictable.
And this chart right here, it shows you that problem in action. See how the levels for the oral pill just flatten out? They hit a ceiling. But look at the injection. It's a straight line up. That's because it completely bypasses that gut bottleneck. It's a direct delivery system, making it way more reliable.
Okay, so the pill has its limits. But what's the alternative? Well, it turns out we can stick with the same trusted drug, we just need to find a smarter way to deliver it.
And that brings us to the big question. What if the answer is as simple as switching from a pill to a pen? We're talking about a tiny injection just under the skin that you can even do yourself. Could that simple change unlock the true power of this anchor drug?
The great thing is, we don't have to speculate. Scientists have already put them to the test in a direct head-to-head matchup, pill versus injection. So, what did they find?
Well, the evidence is pretty darn clear, and it breaks down into 3 huge wins for the injection. 1, it works better. 2, it's actually easier to tolerate. And 3, people stick with it for longer. Let's break those down. First up, does it work better? Absolutely. This landmark study basically settled it. After 24 weeks, you can see that a lot more patients on the injection hit what's called an ACR20 response. That just means they saw at least a 20% improvement in their symptoms. Less pain, less swelling, a clear win for the injection.
Okay, now this next part might seem backwards, but stick with me. The injection is actually easier on your body. You'd think a shot would be worse, right? But because it completely skips the stomach, you get way fewer of those awful gastrointestinal side effects. We're talking about almost half the chance of nausea or diarrhea compared to the pill. That's huge.
And all of this leads to the most important point, persistence. Can you actually stay on the treatment? Well, look at this. In the real world, a whopping 79% of people on the pill had to change their therapy. 79%. Compare that to just 45% for the injection. That means you are way more likely to find a treatment that works and stick with it if you use the injection.
So when the evidence is this overwhelming, what happens next? Well, the experts, the people who literally write the rule books for doctors, start to pay attention. And that's exactly what's happening. The whole philosophy around treating RA is starting to change.
So now, in Europe, the major rheumatology group says, hey, maybe we should be starting with the injection right away. And here in the US, the guidelines are saying, look, before you jump to the next big expensive drug, you have to try switching from the pill to the injection first. It's becoming a standard step. And why does this matter so much for patients? It's simple.
If you can make this first-line, relatively inexpensive anchor drug work for you, you might be able to put off, or maybe even avoid altogether, moving on to those super expensive biologic drugs. It's a total game changer.
So this all leaves us with one last big question to chew on. If the evidence is this clear, if a simple switch from a pill to a pen makes the medicine work better, with fewer side effects and for longer, shouldn't we be rethinking what first line even means? Maybe the best first step isn't just giving the right drug, but giving the right drug in the absolute best way we know how.